You know that feeling when you think there's a missing piece to the puzzle of your own life? Like, there's a reason why things that seem so simple for other people feel like a constant uphill battle for you? Well, today we're going to talk about a topic that for so many is that exact missing piece.
Does this sound familiar at all? You'll start a task, you're full of energy, but you just can't seem to finish it. Or your mind feels like it has a dozen internet tabs open all at once, just jumping from one thought to the next. You're always misplacing your keys, or you miss a deadline, or you accidentally interrupt a friend. Not because you don't care, but because it feels like your brain is just, well, wired differently. And for so many people, this is a total aha moment. It completely reframes the entire problem. See, the constant struggle isn't some flaw in your character, and it's not a lack of discipline. It could actually be something much more specific, something with a name. So if that last thought really resonated with you, let's look a little closer. The very first step to getting clarity is just recognizing that these experiences aren't just in your head. They're real, they're valid, and they're shared by millions of people. You are so not alone in this. Maybe for you, it's that difficulty really listening when someone's talking, because your mind just drifts away. Or that classic pattern of forgetting appointments or important dates. The emotional side is huge too. That feeling of being super impatient or constantly on edge. And this last one, this one is key. Those incredible bursts of hyperfocus followed by complete and total burnout. See anything you recognize there? And this really gets to the heart of the struggle, doesn't it? For years, maybe your whole life, you might have heard words like these: lazy, careless, distracted, and maybe you even started to believe them yourself, all without understanding the actual neurological reason behind it all. And that's really the main takeaway here. If that whole history of struggle feels personal, I want you to remember this: it's not just you. And discovering the why, finally getting that clarity, can be one of the most powerful, absolutely life-changing moments an adult can ever have.
Okay, so we've connected with the feeling of it. Now, let's get down to the facts. We're going to move from that emotional experience to what's actually going on in the brain. Because understanding this is the very first step toward finding strategies that are actually going to work for you. All right, let's be crystal clear about this. ADHD is not a new trend. It's not an excuse, and it is absolutely not a personal failing. It is a real, clinically recognized neurodevelopmental condition. It's all linked to the brain structure and how its chemical messengers, or neurotransmitters, do their job. At its core, it's a challenge with what experts call executive functions, which is basically the management system of your brain that's in charge of planning, focus, and keeping your emotions in check. Now, what's so fascinating is that ADHD isn't just one thing. It shows up in different ways. The inattentive type, for instance, is the one people often miss. It's not the stereotypical kid bouncing off the walls. No, it's the adult who's constantly daydreaming or just can't seem to finish a project. Then you have the hyperactive impulsive type. This is more about that feeling of inner restlessness, maybe talking over people, or making big decisions without thinking them through. And a lot of people have the combined type, which is, you guessed it, a mix of both worlds. So, this is a big question, right? How do you know if it's ADHD or something else? You might be wondering, am I just burned out, or maybe it's just anxiety? And yeah, the symptoms can definitely overlap. But here's the key difference. ADHD is a lifelong pattern. It's neurodevelopmental. Burnout and anxiety, on the other hand, are often triggered by specific situations or a period of intense stress. A professional evaluation is really the only way to untangle it all. We've talked about focus and tasks and all that, but what about the human element? How does all of this affect our connections with the people we care about? Oh, absolutely, 100%. I mean, think about it. If your partner sees your inattention as you not caring, or they see your impulsivity as you being reckless, that's going to cause some serious friction. But once you have a diagnosis, you suddenly have a new language to talk about it. It's not an excuse, but it's an explanation, and that can totally transform relationships. So if any of this is clicking for you, the next logical question is probably, okay, so what do I do now? Well, the good news is there's a clear, structured path to getting answers. It's not some big mystery. It's a process. So what does that journey actually look like? Well, it all starts with a deep dive into your history with a specialist. This isn't just some quick online quiz. From there, they'll build a plan that's made just for you. And crucially, it doesn't stop there. There's ongoing support to make sure the strategies are working and to help you build new, positive habits for the long haul. And this is the really hopeful part. This is where it gets exciting. A diagnosis isn't an endpoint, it's the starting line. It unlocks a whole new toolkit of strategies and support systems that are all designed to help your brain work for you instead of against you. And the range of options is way broader than most people think. For some people, medication is an absolute game changer. For others, it's all about building more structure into their day, or using therapy to reframe those negative thought patterns, or just learning new ways to manage their time and energy. The most important thing is that treatment is never one size fits all. It's all about what works for you. So, let me leave you with this. Imagine for a second that all that self-doubt and frustration just wasn't there. Imagine swapping all that confusion for clarity, because that clarity is what builds real confidence. The question isn't just about managing a condition, it's about finally unlocking your own potential. What could you accomplish if you finally had the right instruction manual for your own brain?